This voiceover will cover diagnostic studies of the respiratory system. A pulmonary function test measures lung volumes and airflow. It is used to diagnose pulmonary disease, monitor disease progression, assess response to bronchodilators, and evaluate disability. Airflow measurement is obtained through spirometry. A computer's software calculates the client's values and compares to an average based on age, gender, race, and height. A bronchoscopy is a procedure in which the bronchi are visualized through a fiber optic tube that is inserted through the nose or the mouth. It is used for diagnostic purposes, such as biopsy, or treatment, such as removing mucus plugs or foreign objects. The client should be NPO for 6 to 12 hours before the procedure and should remain NPO after the procedure until the gag reflex returns. This is to prevent aspiration. Blood-tinged sputum is not abnormal. However, the nurse should monitor for hemorrhage and pneumothorax. A lung biopsy is performed to obtain tissue cells and/or fluid for evaluation. Specimens can be cultured or examined for cancer cells. There are a few different lung biopsy options. A transbronchial biopsy involves passing a needle or forceps through the bronchoscope to collect a specimen. A TTNA, or transthoracic needle aspiration, involves inserting a needle through the chest wall, usually under ultrasound or CT guidance. A chest X-ray is performed after the procedure due to the risk of pneumothorax. A VATS, or video-assisted thoracic surgery, involves passing a rigid scope with a lens into the pleura via 1 to 2 small incisions through the thoracic cavity. A chest tube is placed until the lung re-expands. The nurse should monitor breath sounds and encourage deep breathing for lung reinflation. This procedure is less invasive than an open lung biopsy. It is ideal for a pleural biopsy and resecting lung nodules. An open lung biopsy is used when other procedures cannot diagnose pulmonary disease. Under anesthesia, the chest is open with a thoracotomy incision and a biopsy is obtained. A thoracentesis involves inserting a large bore needle through the chest wall into the pleural space. It is used for diagnostic evaluation, pleural fluid removal, and medication installation. The nurse should observe for signs of hypoxia and pneumothorax. This is done by auscultating the breath sounds in all the lung fields. The nurse should encourage deep breathing to expand the lungs.